Thank you. Can you hear me?
Yes, we can hear you.
Okay. Can you see this?
Yeah, perfect.
Okay. Okay. Welcome, everyone. So we'll be talking about patient and public involvement in research. And I'll be co-presenting with the wonderful Katie Turner. She's one of our public contributors at the RDS. And we'll be going over what patient and public involvement is, why, and how. I particularly will be taking on the what and the why, and Katie will take on the how, and then we'll conclude. We hope that at the end of this, you get a very good insight into what it is. We'll have links at the end where you can get some more information, hopefully. But this will be a quick run through. It probably covers as much as you need to know to begin searching and digging in. So what is PPI? Some people think of it as a gray area. It depends on your research, and people ask questions. What should I do? Is it just conversations with people one-to-one? As a focus groups? Is it a subjective thing or an objective thing where I need to collect actual data or enough information to be able to guide my research? What's this all about? And do I need to be an expert? What should I consider? Do I take on everybody's opinions? What do I need to do? And really, it could be all of these things or just some of them. How do you decide? I think the very fundamental, straightforward way to help you understand what PPI is to think about this definition of involvement. And it is according to involve research being carried out with or by members of the public, as opposed to them, about them, or for them. So you are really going with or by, and that's where we want to go in terms of involvement, as opposed to, about, or for. It's not to say that doing research to people or about people or for people is a bad thing. It's just that it's not rightly placed when it comes to involvement. That really comes under participation, where people take part, and it could be about them, it could be for them, and they take part as participants within the research. But when we say involvement, they come in at a different level, and they help guide the research, and they work with you in a different capacity as opposed to being participants. And what does that mean? Who are your public? Who are these people we're trying to describe? The public could be very wide ranging, could literally be anyone, someone may argue. But sometimes it's best to think about it as from the point of view of your own research. Think about who would benefit, what would be useful for people relating to your research or with regards to your research. So we could have patients, we could have potential patients, we could have carers, people who use health and care services or social care services, or people who represent them. So the public could be wide, but when you think about it in terms of your research in particular, it's best to consider who would be the beneficiaries, who would benefit from your research, and you can think of them as public as you begin to involve them in your work. And then back to involvement, how, in terms of, I mean, Katie will talk about the how in detail, but practicalities to just help you understand the approaches you could take. You could think of these approaches as four, there could be more, but just again, for simplicity and clarity, you can think of it as consultation, collaboration, co-production, or service user control. And when you think about these, it really speaks to power. How much power does each of you have? That is you as a researcher and the people you involve in. And as you go down this list, power becomes more intense or increases towards the members of the public or shared, as opposed to you being the researcher and having so much control over the work. So with consultation, you are asking for people's opinions, and all of these are good. So it's not to say consultation is the poorest and service user controlled research is the best. Not to say that. You have to consider your own research. However, you need to know what each of them is and how you can apply each of these approaches, or which of them not to use at all. With consultation, you're asking people's opinions. You're trying to find out what they know, how they can contribute, what their experiences can bring to your research. But it depends. You decide. Really, it depends on you how much of these you take on board. As opposed to collaboration, where there's more. joint working. So people can help develop your questions, your interview sheets and guides, and you take that on board even more so you work together with them. Sometimes feels like a fine line between consultation and collaboration. Sometimes you start off trying to do consultation and you end up with collaboration or vice versa. But it's just really about if you consider it in terms of how you respond to what has been given to you, then that could help you distinguish them more clearly. Co-production is a big one. There's lots and lots are out there regarding co-production, but this is where everyone has equal power, in quotes, if you want. You can describe it in this way, where everyone brings their ideas and their thoughts to the table and everything is considered. And together, you and those you're involved in your research work together to develop, design, walk through, share everything about this research. And of course, service user control is where people actually take charge of the research themselves and you support. So we go on to the why. Why do we have to involve the public? Why is this so important? Is it compulsory? What if people don't respond to me? What if I can do anything about it? I've tried and it's not working. And can you really get all the perspectives? Really all the perspectives? Why do we need to do it? Does it make a difference? And why? Why really? Well, there are some very important things to say. Research shows that is very important and it can help you research in different ways. Well, the first thing to say is that it can definitely, certainly improve your research, the relevance of it, and the quality of it. Because if you're speaking to people who know a lot about or have experience about the subject area or what you're trying to investigate, how much wonderful or much better it is to speak with them. And they can guide your research in wonderful ways. Again, this is a very quick overview, so we can't go into fine details, but by all means, reach out to us and we can talk to you about your research in particular. But there's so many ways people can bring relevance and quality to the research you do. There's a moral imperative, if you want. This is research about people and paid for by the public, and it would be very useful to have them involved. And also, if these two things don't convince you in any way, it is actually compulsory. You may be disappointed to hear this, but you really have to demonstrate how you've involved the public in your work as you apply for various funding streams that we've been talking about so far. So I will pass on to Katie at this point to talk about the how.
Oh, thank you, Funmi. Just checking, can everybody hear me? Wonderful. Okay. So I'm going to just spend 10 minutes or so going through the how and giving you a few examples. And could we have the next slide, please, for me? Thank you. And I'm going to use the UK Standards for Public Involvement as a framework to talk a little bit more and explore a little bit more about the different aspects, if you like, of PPI and how you might consider and use them in your research. These UK standards were developed around, I say, probably 4, maybe 5 years ago now by a UK-wide partnership. They were designed to sort of encourage reflection and help researchers and a research team evaluate alongside the progress of the research what's going well and what could be learned from and changed. And they can also be used, very importantly, to help you design, review and assess the involvement that you decide to have in your research. These standards are very much a guide, and the things I'll cover are by no means exhaustive, but just to get us started. Next slide, please, from me. So the first of those standards is inclusive opportunities. And this is all about being very clear from the outset about who you need to involve. So that's very much about matching the experiences of the people you want to involve with the end users of your research project. And target your recruitment to get your PPI involvement so that it reaches the very groups you want to get involved. It's quite hard if you've been involved in PPI before to sort of keep using what we call, and this is in no way derogatory, the usual suspects. People are very keen to get involved in research, but it's good to open out the field and get new people involved. and be very transparent in your approach, in your recruitment approach. Explain how and why, and that you're choosing people, and be very clear about your selection process. Also very important in this part is to identify and address any barriers to involvement. So think about location, transport, timings of meetings, frequency. Do people have disabilities, caring responsibilities, or work responsibilities? And obviously we are in an online world at the moment. That makes some things easier and perhaps other things a bit more challenging. Next slide, please, from me. Working together. So this is working together in a way that values all contributions, builds and sustains mutually respectful and productive relationships. And Funmi talked about this in her part. I think for me, the most important thing here is the need to, Funmi was talking about power, and it's very important at the outset to really address what we call hierarchies of knowledge. Research knowledge, clinical knowledge, often what the public and patient people can bring is even now regarded as somehow inferior to that. So it's all about trying to create a level platform so that you know, everybody's perspective and expertise in from their particular experience and knowledge is reflected and explored and shared and used. Next slide, please, from me. Support and learning, really important. I found in my work, both as being involved as a PPI representative and as of guiding and advising others to involve people, that you really need to build in your support and learning at the beginning. It's about offering and promoting support and learning opportunities, building confidence and skills for public involvement. Make sure you've got your budget sorted out, you've got an adequate budget, and that you've covered payment and expenses, and you're clear about how much you can offer people and how you'll do that. There's different types of support, so you might be supporting your PPI reps with sort of problems with, I don't know, transport or location or caring or all those sort of practical things. But it's also important to really be aware that if people use their lived experience, their personal knowledge of the subject matter that you're researching, you know, it's going to touch on very personal memories, experiences, and often that triggers a whole range of feelings, which is great in a way, because it adds to the research, but you need to make sure that that is adequately supported. And it was one thing that isn't really, to my in my opinion, supported enough. It's often overlooked. Next slide, please, for me. Communications. So I think we all hopefully appreciate the need to use in plain language. As a researcher myself, I often fall into the trap of using research jargon and quite rightly get pulled up on it. It really do try and use plain language and in your research tools and methodology, so that people understand from the outset what you're doing. And actually, it's a really good exercise. I was involved in an earlier presentation and we had a really good discussion group, and people were saying, well, it's not about simplifying, you know, research or dumbing down. It's about opening it up and you know, presenting it in a way that everyone can understand and it's accessible to everybody. So that's really important. Also, keeping people informed, you know, keep that communication line open so that you keep people informed along the route of your research about what's happening, how their impact is affecting the project, and what the outcomes are. Next slide, please, from me. Impact. So I guess this is about thinking about improving your research and the research process by sort of identifying and sharing the difference that public involvement makes to research. And often people say, well, you know, it does make a difference, but you will be asked how it's made a difference. And there's lots of ways you can do that with your PPI team throughout the course of a project. You can hold reflective spaces where people have a chance to think and explore in a safe space how their contribution is impacting on the project. And you can keep minutes, you can keep notes of focus groups or meetings you've had with your PPI team to really note down what they've said and how that's impacted the project. That's really important. But I would also add, it isn't about just proving, if you like, that public involvement works. It's about improving, I like to think it's about improving how we work together. So there's that constant reflective process, which I think is helpful for any research team. Next slide, please. And the final standard is governance. So this is about the public truly being involved in decisions about the governance of research. So making sure that the research is managed properly, that it's doing what it said it would do, that it's ethical, that it's well regulated. Often this part sort of gets a bit lost with PPI, but it's very important. If you have people with that lived experience on the governance, if you like, the governance sort of meetings like a trial steering committee or an advisory group, they can really help to make sure that the research is keeping on track and considering all those ethical issues that sometimes occur to people with that lived experience that may not occur to others. And on to the next slide, please, from me. So I've just had a real whistle stop through those standards, and obviously there'll be time to ask questions and perhaps explore those a bit more. But I'm just going to go through a few top tips. Obviously, involvement as early as possible is really good. That doesn't mean to say that if you involve people at a later stage that it's not worth doing. It's very worth doing. But I think you'll find if you involve people as early as possible in the thinking about what you might research, you will find your PPI contribution is much richer. I've talked about accessibility, both in terms of practical issues and in terms of keeping your communication, your language very clear. Make sure you've got enough resources within your team, or if you're doing a research project on your own, to really support the public and patient involvement. And that is all about not only practical things, funding, but also that support that you will offer. Make sure you've got training and support. Acknowledging the expertise of the patient and public is very important, often doesn't get done enough. And obviously it's always really good to be clear about what you're doing in your research and what you expect people to do in their roles. That's my bit, and for me, I'll hand over to you to finish up. Thank you.
Thank you very much, Katie. That was very lovely. I hope it's helped. So we're clearly talking about applications and what to do with them, and you've understood hopefully a bit more about the what, the why, and the how of PPI. But back onto the application itself, what do you need to know? Again, this is a very quick overview, and your research will be bespoke. So please speak to us just so that we can help you properly in a very tailor-made way. So you will be asked, you have to demonstrate really seriously that you have considered PPI right at the outset, and how you've applied a PPI or paid attention to PPI all through the life of your project. So you'll be asked how the public have been involved and how they will be. So this is you planning ahead. So far, what have you done? And we have the Public Involvement Fund, which could help you begin to work on your PPI side of things before you even write up the application and send it off. You'd be able to explain the roles of the patients, the public, and whoever you're working with. And as Katie has been talking about resources, what have you done to support them, and what do you have, what are you including? And of course, the plain English summary. Sometimes this could be a very challenging one for researchers to write up because we're so used to speaking in a certain language. But your members of your PPI team could really help you with the plain English summary. and also addressing how PPI will be managed, how it will be reported and evaluated would also be checked, and then the why, or why you're working with a certain group of people, who would you be working with, and how does this all fit into your application. So hopefully all these will help. And then as we just conclude, we've talked about the what, the why, the how, and hopefully, although very quickly, we've talked about what patient public involvement means when it comes to your applications. We hope that this is giving you a sense of what to expect. Thank you.